It is hysterectomy time. About to drive over to the hospital. Noon check-in, 2 o'clock surgery. So I will see you guys after. Just really quick, as far as how am I feeling pre-surgery, totally fine, chill, not nervous. Maybe that'll change when I'm there, but we'll see. See you guys after. We've made it to the hospital. Dun 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 dun. Still chill. I'm here, just checked in. It is now 12:20, and I just had to do a quick hearing sample. Gross, I know. Gotta see if I'm pregnant. Which I am. This is like a hotel, right? Had to take a little showers in this. Some wipes. Oh, at least they're warm. Getting this gown. Alright. Pretty bad. Ow! You got your nail on me. Ow! No, you just scratched it. It's like a scar. My feet are freezing. Here's my glasses. Nah. This is a comfortable bed. Comfier than in Mexico. Mostly because I was like on the tray. I'm getting warm. And I'm not what time is it?
12:43.
A whole nother hour.
Well, they still have to come and give you like an IV and everything too.
Well, I'm glad she hasn't paired me yet, because sitting here with it, Recording? Just like cramps, pressure, kind of towards the front and also my back, lower back. Not unbearable, but uncomfortable. Almost like I need to go pee again, which I probably do have to soon because I just drank water. Oxygen looks good. Just ready to go home. How was your waiting?
Typical waiting.
Did it seem long? Cramps. Okay.
Probably like a good hour. Or more.
I'm seeing now. So, still groggy. Still a little sleepy. I don't feel like it was the best nap of my life. I feel like I need a nap. I feel like they just made me rock. Throat is very sore. Just, I guess a little worse. Oh, 5:34. Surgery's done. Laying in the hospital. Got my expert driver. It is now 5:45. As of right now, just some cramping, back pain. Alright, just got home post-op. It is 6:23 and I am tired. I am cramping. It is pretty uncomfortable right now. Yeah, just groggy right now. Don't really have an appetite quite yet. And I did have what's called, gosh, what the hell is it called? Can't even think. I have to come back when I have the mental capacity to actually think some more. But right now, just laying down. It was about a 30-minute drive home from the hospital. And nice thing is it's later in the evening, so I'll be able to get some rest. In case I said the time wrong, it is 6:24. 6:24. But overall, everything in the surgery went well. Let you guys know how it feels by tomorrow. Almost forgot to mention, they did have an incubate me, where they put the tube down my throat. My throat's not sore, just a little hoarse, which is nice. Not too bad at all. Besides feeling groggy, I'm also feeling a bit of bloating, like gas in the area. Doctor said I could take some Gas-X, which is quite nice. And coming home, she said I could take another dose of some Percocet, which is what she prescribed me, and ibuprofen. So I did that as soon as I got home. And that pressure that I'm feeling in my abdominal, even though it's gas, sometimes it does kind of give the sensation as if you need to use the restroom. But I know I don't. And anyways, other than that, just trying to chill, relax, and hopefully here in another 30 minutes I'll eat, just so that way I can keep my nutrition going, since I did have to fast since midnight last night. No shower. Doctor said I cannot take a shower till tomorrow, which I'm not a fan of, because I always like to feel fresh when I get back home, especially in my sheets. Coming from a hospital just feels more hygienic. But I'll take doctor's orders and just shower up in the morning. Thanks all. Talk to you soon. Alright, memory's kicking back in, and it is 6:29. I had what's called endometriosis. I don't know if I'm even pronouncing it right now. But basically, it's like thickening in the lining to where it creates really intense cramps. And that's exactly that was happening to me for the last 3 months, where my cramps were just so intense to the point where I had to take some ibuprofen or Tylenol just to ease and settle that. But now that that's removed, should not have that issue anymore moving forward. So, nothing to be concerned for. Percocet still hasn't kicked in. Pain is not very comfortable. It does burn when I pee and there's spotting. So I have to wear a pad. What the hell? Just for now. So I just went downstairs, had some dinner, did my dishes, whatever I can do to just kind of keep moving. The anesthetics has me super sleepy right now, and it kicked in even more. So now I'm just kind of laying down, relaxing. I will fall asleep for the evening. This so far is just extremely fatigued, and I do have that cramping, so I'm sure with some rest it'll kind of alleviate some of that. I think so far that's the worst part, but as far as movement, mobility in general, doesn't feel too terrible. It's not painful to move. Again, it's just that cramping. So think of a really intense cramp. And I wouldn't even say this is the most intense cramp I've ever felt. I felt worse than this. It's just that anesthetics that has me so tired that, I'm getting really sleepy just with movement, walking around. So again, good thing it's already evening time. This gives me a good chance to just rest and relax. But we'll see how it goes tomorrow. Let you guys know. And pretty sure it'll be good. Sure, I'll have some more energy. The doctor did inform me your energy level is essentially the last part that tends to creep back up. Alright, so it's 8 o'clock. Got home at 5. 3 hours later, I decided to take a shower because being at the hospital is gross. I have 1, 2, 3, and 4 incisions that were done laparoscopically, robotic, all done. And this will stay in for about 2 weeks. If it doesn't fall out, then I get to just take them off. So it's 8:05, just 5 minutes from my last clip. Went downstairs to grab some pineapple. I really don't have that much of an appetite. I made a protein shake so that way I can add some berries and avoid getting backed up from the anesthetics. And of course, pain medication can constipate you too. And then of course I have some water just to get that hydration level back going. Get the hydration level back up. Yeah, don't have an appetite. Just sleepy and a little bit of pressure abdominal. Just a couple things to mention. Because promoting walking is good for you. Since surgery, I've already walked about 2,000 steps. So I think that's good. And I also have a heat pack on my lower back. Just a plug-in one. Giving a little bit of comfort and relieving some of the pain. Alright, I'll let you know how everything looks and feels tomorrow. Thanks for tuning in. Bye. Got my adorable heat pack. Oh, thanks to you. And my stitch socks.
Stitch socks for my
Stitch for stitches. Sticks for stitches. This side of Percocet every 5 to 6 hours. Woo woo. Time for bed. So it's about 10:20. I was trying to go to bed like 20 minutes ago. And the pressure on my lower back is uncomfortable still, even after taking a painkiller. So I'm gonna use the pillows to kind of prop up my legs to take a little bit of the pressure off my lower back. These are the exact same pillows that I used post-op during my body masculization, and they worked good to just help take that pressure off. I don't know if I can sleep on my side. The back does feel the most comfortable even with that pressure. So if I had to explain that pressure, it's like a cramp, but it doesn't go in intervals, so no waves. It's just a consistent pressure on the lower back. And my abdominal area, when I lay down, it is a bit sensitive to where I don't want any weight. But I mean, I could touch it perfectly fine. It's not hurting. Just don't want any weight. And standing up, kind of the same thing. I just don't really want to put a whole bunch of pressure. It feels uncomfortable, and I think a lot of that has to do with the gas. Took the gas X, just 2 of them, and I feel alright. I haven't been gassy, it's just the gas that's still within my body. So, let you know how I sleep come tomorrow morning. Yep. Didn't think I would see you guys again. Darn it. Bringing back some flashbacks. Alright, there we go. Sleep setup. Yes. Squishmallows are a must. Alright, it's 10:30. I swear, I'm just not sleeping yet. But I'm gonna switch from heat to a nice pack on my lower back. I don't know, something tells me ice might feel a little bit better. But prompting it a little bit does feel good. Putting pressure with sleeping my back isn't bad either. But I'm sure I'll fall asleep soon because that sedation's still there and I do still have that grogginess going on. Yeah. Sleep, man. My enemy. Although I do enjoy it. Alright. Stay tuned and see what tomorrow morning's like as far as pain level. I want to say I'm about maybe a 7.